Q&A area to the right of the viewing window. It looks like we're ready to get started, so I'm going to hand it over to Jennifer to begin.
Great. Thank you so much, Ryan. And welcome everyone to the session. Really excited to have you all here today. We have a really exciting panel to talk about child nutrition reauthorization. And I'm going to briefly acknowledge my co-presenters. I'm not going to give the full background on everyone because you can, but I am Jennifer Weber. I'm a consultant that is here on behalf of 1000 Days. And I'm joined by Cassidy Punt from Save the Children and Carolyn Vega from Share Our Strength. And you can see from the slide that we're showing that we're all registered dietitians and have masters in public health and are really dedicated, and I give dedicated our careers to strong child nutrition programs. So we're excited to share those experiences with you today. As you heard, if you have questions, please type them in the Q&A. We have some time dedicated at the end to answer those questions. And we certainly also encourage you to use the chat if you want to react to things we're saying or share some insights. Please utilize that feature as well. So now I'm going to go ahead and turn it over to Carolyn to talk about
Great. Thank you so much, Jennifer, and great to be with you all today. So yeah, I just kicked off with the poll about how much do you know about CNR, because as I go into this background, it would be great to know who I'm talking to and how much you know. So please go ahead and answer that question. And so while you're all doing that, I will just start off by saying, you can probably guess by the Capitol Dome in the photo on this slide that Congress is a central part of child nutrition reauthorization. And so just a reminder, as very basic background, that the child nutrition programs like school lunch and summer meals are federal programs created and governed by Congress. The U.S. Department of Agriculture fleshes out and implements the framework set by Congress, but USDA can't go beyond the authority that Congress gives. Similarly, state administering agencies have to stay within the bounds of federal law and USDA regulations and guidance. So this is why CNR is so critical to understand, because it really sets these core requirements. All right, I'm going to see what our poll results are. All right, looks like people know something about CNR, but not a lot, so that's great. You're in the right place to learn more. And I will not give any more super basic background like I just did, since you all know at least a little bit. All right. So in general, though, child nutrition reauthorization is the process of reviewing and updating the laws governing all child nutrition programs that occurs roughly every 5 years. So rather than passing individual bills to make a specific change to one child nutrition program, Congress looks at all of the programs together on a regular basis. And this process does everything from small policy tweaks to authorizing pilots to creating brand new permanent programs. And I will just note that since the early 80s, so it's been roughly 25 years or 6 reauthorizations, it has been true that CNR is every 5 years. Before the 80s, there were actually more frequent bills as the child nutrition programs were piloted and made permanent and refined. But the last reauthorization was in 2010, the Healthy Hunger Free Kids Act. There was an attempt made roughly on schedule in 2016 to reauthorize the programs, but that effort unfortunately fell apart. And there have been a few efforts made since then, but nothing so far has gotten quite as far as 2016. So the other panels will discuss specifics of the Healthy Hunger Free Kids Act as we go along in our presentation. But before we dive into that, I do want to talk just a little bit more about how the CNR process works. So these are the programs covered by Child Nutrition Reauthorization. These programs are permanently authorized, so even when Congress is overdue on CNR, they do not end. And most of these programs, WIC being the main exception, are set up as entitlement programs, meaning that they don't depend on annual appropriations to continue getting funded. And they generally just get funded with however much is needed to reach the need of eligible participants. That said, Child Nutrition Reauthorization does include other things like farm to school funding and equipment grants and nutrition education support and other pilots and other things. And those things can lapse without additional funding appropriated each year. Okay, the process. So first up, as you see, the committees of jurisdiction are the House Education and Labor Committee and the Senate Agriculture Committee. So these committees do a bulk of the work on this process overall. So it's not the full House debating CNR, it's not the full Senate debating CNR from the very beginning. The work really originates in these committees and they manage a lot of the process. So the process starts with public committee hearings. So the Education and Labor Committee or the Agriculture Committee will call witnesses representing, different sectors of the child nutrition programs to come in and talk about what's working, what's not working, how things could be better. Based on that kind of public input, marker bills are introduced. So marker bills are never really intended to be passed as standalone bills. So it's not that old Schoolhouse Rock version of how a bill becomes a law. They are really more about messaging and setting different policies, priorities for the overall process. What happens with all those different marker bills and all those different ideas running around on specific policies and specific programs is that the committees pull together all of those ideas into a package. So they'll introduce that package that incorporates all of these ideas across all of these programs. They'll debate it, they may amend it, and then they pass that package out of committee that encompasses all of those programs and makes all of the different changes. So then the full chamber, the full House or the full Senate would have to vote to pass that package that the committee had passed. And then if needed, you would have a conference committee that reconciles the different versions if the House passed a different version than the Senate. And then once they come to an agreement, you got to pass that final version. So the House and the Senate are passing the same version of the bill. And then finally, it would be signed by the president and become law. I guess another option that may occur is that one chamber may lead on the overall process. So for example, the House Education and Labor Committee could kind of go first. They could pass their package out of committee, out of the House, and then the Senate could kind of take that up. Maybe they pass it as is, maybe they just make some small tweaks, but then there's less of a conference process in the end if they kind of follow that framework. But on the whole, this is how the process is all supposed to work. But where are we now? So the House Education and Labor Committee did pass a committee bill over the summer, but it did not get voted on by the full House, and the Senate has not taken it up. And so we are currently in what's known as the lame duck session in between the elections that happened earlier this month and the end of Congress at the end of December. And it's hard to get things done in the lame duck, especially when there has to be a spending bill passed. So there really aren't good chances for a full CNR with, the Senate kind of considering their own package or taking up the House package. We also know that because the Senate Agriculture Committee that would manage CNR also has to work on the Farm Bill next year, that they probably don't want to do CNR next year when they're busy with the Farm Bill. So that really doesn't leave us with a lot of great options. There are some talk of adding in some CNR priorities to that omnibus spending bill that needs to get passed, but kind of up in the air, kind of unclear what that would end up looking like. The main thing we do know is that it would not be quite the same as if a full traditional CNR were passed. So basically, I feel like everything I just told you about the process, throw it out the window. We're in a weird place. We'll see what happens. But maybe we'll be back in a year or two going through that full process again. We'll see. But for now, on happier subjects, We are going to talk about some victories from the Healthy Hunger Free Kids Act in early childhood, in school meals, and in out of school time programs. And we will also talk about opportunities for whenever we get to do child nutrition reauthorization related to these 3 different areas. So with that, I will turn it over to Jennifer, and she will start it off talking about the early childhood programs.
Great, thank you. Yeah, and I'm going to talk specifically about 2 programs on early childhood that are included in child nutrition reauthorization, typically Child and Adult Care Food Program, or CACFP, because we love acronyms, and then the Special Supplemental Nutrition Program for Women's, Infants, and Children, which we all refer to as WIC because it's such a long name. So if we can go to the next slide. I mentioned that I'm a consultant for 1,000 days, and just to frame a little bit what that means, when we talk about the 1,000-day window, that really covers pregnancy, infancy, so birth to 6 months, and toddlerhood. So those are just really critical years in the development and growth and laying down the framework of a strong body and a strong mind for children. And so we really are, continuing to build support, investment, and strong programs in the early years of life. So these are really important components of the Child Nutrition Reauthorization. And I will mention that there was just a special supplement in the American Journal of Public Health that focused specifically on nutrition in the first 1,000 days. And I can drop a link to that in the chat. But we have a lot of messaging and quotes from both government officials and physicians and others about the importance of nutrition in the first 1,000 days. And those can be really powerful when you're building support around the need to invest in these programs. So digging in specifically on the next slide, just a snapshot of WIC. I mean, I think it's a program that many in the hunger community and nutrition space have heard of and are aware of, but I also think it's always good to take a look at who does WIC support and what's it made up of. And you can see, millions and millions of mothers and infants and toddlers benefit from WIC. And nearly half of all infants born in the US participate in the WIC program, which I think we talk about that statistic a lot, but it's really amazing to think about the support that this program is providing. And, it's a very diverse population that WIC serves, and we're seeing that continue to grow. And so we're always looking at how can we make sure that this program and the services that it provides can meet the community that we're serving. And WIC, the core components of it are really, we often think about 3 parts. I think people maybe know most about the food package, which are very specific foods that participants receive cards to go get from the stores. It also provides nutrition counseling and support, which is really important, and then referrals for additional healthcare services. So it's a really comprehensive package. And when we look at the advancements that have happened in WIC over the years, on the next slide, the 2019 Healthy Hunger Free Kids Act, across the child nutrition programs was really groundbreaking in the amount of changes and improvements it had. And for WIC, specifically, much more investment in breastfeeding, a really effective breastfeeding peer counselor program, recognition programs for WIC clinics that were really, working on how to support and advance breastfeeding and their clientele. Also a transition from paper benefits to the electronic benefit transfer system that had happened for SNAP earlier, but was a bit more complicated for WIC. And so provided investments in that. And another key part is that it required WIC food package review every 10 years. And I'll talk about that a bit more, but we had pretty much the same WIC food package for many years. And then finally got an update of the WIC food package. And actually, we're waiting any minute now for a proposed rule for another update to the WIC food package. And I know that this session is really focused on child nutrition reauthorization, but I did also want to mention that there were some real advancements during COVID to make WIC more accessible and also enhance some benefits. And so, two things that resulted during COVID that we really are wanting to see in child nutrition reauthorization go forward is one was an enhanced fruit and vegetable benefit, so an increased dollar amount so that participants could purchase more fruits and vegetables. That's in line with the scientific recommendations, and hopefully the revised WIC food package will have that. And also these other changes to allow virtual visits so that during COVID, when so many things shut down, people didn't just lose their benefits because they couldn't go and do eligibility or do the nutrition counseling visits, but they could do those leveraging technology. Those pieces only are allowable because we're under the public health crisis. If those designations change, it would go back to requiring everything to be in person. So those are the things that we found really increased participation in WIC, and we're hoping to see them continue going forward. So looking at the next slide, I want to talk a little bit about child and adult care food program, and then on both these, and I'll talk about a bit more about what we're hoping going forward. I think CACFP is a bit of a hidden gem. People maybe don't know as much about it as they do about some of the other feeding programs, but this is a program that is administered at the early care, early Head Start level, where it provides funds for meals and snacks for children in childcare programs, and there is also a small amount that goes to adults that are in adult daycare type programs. And this is not just like large centers or Head Start. This is also a program that is available and can be used by in-home providers, those smaller providers. So it can be a really amazing resource for them to help support and provide funds to feed children. And so right now we're getting close to 5 million children served in CACFP. We certainly would love to see that increase. Again, it provides funding for meals and snacks, also technical assistance and support around what are the needs of children in this young age. And, it really also does promote breastfeeding too, so that, if there's a parent who's breastfeeding and they want to go in and breastfeed in the clinic, there's support for that and actually reimbursement for that in the program. So it's really a comprehensive approach. And this one, if we go to the next slide and look at what the Advancements Toward Healthy Hunger-Free Kids Act, I would say that this was a huge bill and enactment for CACFP. At its core, it really started transitioning it to be a nutrition and wellness program, acknowledging that it's important to provide food. This program is really about strengthening and providing really solid nutrition for younger kids that are in care outside them. It also required a review and updated nutrition standards. Again, the CACFP meal and snack standards had not been updated for a long time. And importantly, it also required meal cost assessment. So it isn't just, well, let's put some nutrition standards on the childcare providers, but let's really think, look at what it costs, and do we need to have comparable change to reimbursement rates. It also, included importance of physical activity and limiting screen time as part of the overall goals. Really identified the importance of state licensing to be engaged in childcare and CACFP, that we really should be looking holistically at ways to support nutrition. And then importantly, included efforts to reduce paperwork and streamline program operations. Many of these providers, right, it's family-owned businesses in some cases, small in-home providers, and if there's really cumbersome paperwork, it's not worth them to participate in the program. And we really want to have more providers participate. So anything that can reduce that, paperwork burden is really important. So when we look forward on, what are opportunities for early childhood and child nutrition reauthorization, I put 3 overarching categories here. There's certainly lots of details underneath this, but importantly, I think first of all, we really want to improve access and increase participation in the programs. So when we look at that from a WIC standpoint, that is, expanding eligibility, allowing longer certification times so families don't have to, keep getting certified, in 6-month, 1-year basis, like, really allowing 2-year certifications, having longer certification for postpartum moms, and looking at allowing kids to stay up until 6. We know that there can be these gaps between age 5 when children go off of WIC and when maybe they are in school and can benefit from the school meal programs. And so looking at how can we increase access and participation. On the CACFP side, that it means looking at, can we decrease the requirements for area eligibility so that, there are communities that are just limited in their ability to participate because of the way the calculations are done around low income students or children. We always, of course, want to have strong, nutrition guidelines. And that doesn't just mean what are the requirements on food served, but really strong support for the people that are implementing them. So we're excited that a new WIC food package proposal is coming out, and hopefully will include that stronger fruit and vegetable benefit, as an important piece, and then continued support for childcare providers so that they have the tools and resources they need to support families. And then I mentioned, streamlining and modernizing program operations. We learned during COVID that, it could be very effective to do, eligibility visits and nutrition counseling pieces online, that even for CACFP, some of that technical support and work could happen in online settings, and things that really reduce the burden of the participant is of utmost importance to us. So those are pieces that we're hopeful for. You heard Carolyn mention we're sort of in a funny space. I don't know that we'll get our full laundry list, but we are really prioritizing things that, will make the program easier for people to participate in. So those are some of the things we're looking forward to. Certainly happy to take questions on it later on, but I think I'm going to hand it over to Cassidy at this point to talk about a slightly older age group, where they go after they are finished with WIC and CACFP.
Thank you, Jennifer, and great to be with you all today. And so today I will be focusing on school meals, particularly the National School Lunch Program, the National School Breakfast Program, variances within them, and beyond. And so thank you, Carolyn. And if we go to the next slide to level set everybody here, both of these programs are federally assisted meal programs that operate in public and nonprofit private schools and residential childcare institutions. Now, the meals served through these programs must meet certain federal nutrition standards, and reimbursements are based on a formula and depend on how many meals are served free, at a reduced price, and paid for. So typically, families do have to submit applications to qualify their child to get a free or reduced price meal. And how that's structured, if you're not sure, is at or below 130% the federal poverty line, that child can receive a free meal. If a family is between 130 and 185% the federal poverty line, that child can receive a reduced priced meal. And above 185% the federal poverty line, that child can receive a low-cost full price meal. Now, on the administrative school side, the meals have to be counted, recorded, consolidated, and reported in order for the school to be properly reimbursed for meals served under both the lunch program and the breakfast program. Reimbursements are based on a formula that are updated every year. Now, we all may have images in our heads of what school meals look like, but in reality, school meals are healthy. And I'm sure we all saw this headline when it was released by CNN in April of last year. And there are many benefits to participating in the school meal program. I'd say perhaps the largest impact is children are being served nutritionally balanced food meals, which they otherwise may not be getting or be getting exposed to. Research has shown that the meals that meet these federal nutrition standards provide about 1/3 or more of the recommended levels of key nutrients. And if we zoom out and think, well, what's the impact more broadly? School meal participation improves dietary intake, reduces food insecurity, reduces risk of obesity, allows children to focus better in school and achieve higher test scores, have improved mood, better behavioral problems, and fewer absences. And perhaps the meals are so good is due to federal nutrition requirements based on legislation, which the last piece of legislation that greatly impacted these programs was the Healthy Hunger-Free Kids Act of 2010. Thank you, Carolyn. And the goal of this was to really increase the nutritional quality of school meals and to more closely align them to the dietary guidelines for Americans. So the new set of standards of nutrition for both the lunch and breakfast programs and other child nutrition programs increased whole grains, fruits, vegetables, and portion sizes of fruits and vegetables. And if we drill down to the specifics, what I have listed here is it ensured students are offered both fruits and vegetables every day of the week, increased offerings of whole grain rich foods, allowed only fat-free or low-fat milk to be served on the program. It limited calories based on the age of the children being served to ensure proper portion sizes, and increased the focus on reducing the amounts of saturated fats, trans fats, added sugars, and sodium. Now, it also did a number of other things for school meals, including it changed the standard for school breakfast to be phased in over 3 years at the time so more schools could comply easier. It strengthened local school wellness policies, requiring more engagement from the local level, and it actually provided incentives for schools to meet the new meal standards, and this was an additional 7 cents as of the 2020-2021 school year. Now, we just heard the changes and how nutritious they are, the benefits of school meals, but how many kids actually participate? Well, if we go, thank you, Carolyn, that the most recent data from our partners at SFRAC show that during the 2020-2021 school year, about 19.8 million children participated in the lunch program and about 13.9 million participated in the breakfast program. Well, why is there such a discrepancy and there's less children in the breakfast program? Well, there are barriers to the breakfast program. And on the next slide, we'll see that early transportation to make it in before school starts to have breakfast is the biggest barrier to participating in the school breakfast program. Children may have to take the bus that arrives just in enough time to get settled and start school and not to go and have breakfast at, say, the cafeteria. There's also the stigma and the shame that goes along with this. Going to eat breakfast before school can carry a lot of shame for a child. And so with this being the biggest barriers to participating in the breakfast program, there are a few service models that can help with this. So I have 3 listed here that I'll take you through. The first is breakfast in the classroom. So this is where kids can get involved, or you can have staff deliver breakfast via coolers or insulated rolling bags to classrooms. Takes just about 15 minutes and can happen while the morning announcements are going on or while the morning routine is taking place. Research has shown breakfast in the classroom is the most effective model, and schools reach about 88% breakfast participation with this service model. The next service model is grab and go. This works well in high traffic areas where students typically walk, like hallways, cafeteria, entrances, and students can eat in their classroom or in a common area before and after the bell. And then perhaps second chance breakfast is more for the older kids, where this could be midway between breakfast and lunch or between first and second period. And it's really effective for those who may need a little bit more time to wake up in the morning, or if they're too busy socializing before school. And now if we zoom out to think about other ways to increase participation in school meals as a whole, here are just a few. 1, awareness of the program, the menus, the options, what school meals are. They're appetizing and they're nutritious. Helping families fill out the application process. This, as you can see on the right, is an image of a part of an application. It can seem complicated and overwhelming, especially to those who English may not be their first language. So help filling out these applications is very effective. On the administrative side, making sure that these schools and institutions have the administrative capacity to process these applications in a timely manner, and getting students involved, asking what they'd like to see on the menu, doing surveys of trying different foods, and really making it feel like they're a part of the process and collaborative with it. Now, some schools can basically serve free school meals to all, and this is again thanks to the Healthy Hunger-Free Kids Act of 2010, which made community eligibility provision an option. As you can imagine, this greatly increases participation in school meals because, as you'll see here, CEP allows high-need schools to serve breakfast and lunch to all students at no cost. For schools to be eligible to operate CEP, a school or a group of schools within a district must have an identified student percentage, ISP, of 40% or higher. Now, ISP is when all of the students who are categorically eligible for free school meals divided by the total amount of schools enrolled. So to break that down a little bit, categorically eligible means a student or family is already receiving SNAP, formerly known as food stamps, TANF, which is the Temporary Assistance for Needy Families, FDIPR, Food Distribution Program on Indian Reservations, and in some states, if that child or family is receiving Medicaid benefits, if a child is homeless, in foster care, migrant, or enrolled in Head Start, all make them categorically eligible and fall into the category to calculate ISP. Now, reimbursements are based on the ISP and what's called a multiplier, and the multiplier is currently 1.6. So to help conceptualize what this means, a little math example for you. So if we have a school with a 40% identified student percentage, using the 1.6 multiplier, they get about 60% of meals reimbursed. So the main takeaway here is that CEP is not always financially viable for schools with how the current ISP and multiplier stand. Now with CEP, families do not have to submit applications to receive a free meal if in a CEP school or district. And there are so many benefits to CEP, both for the family, the student, and for the school as well. For the student, the biggest one is that it completely reduces the stigma of receiving a free meal, completely levels the playing field for all students. For families, they don't have to worry about student meal debt. They don't have to worry about the burden being put on their child of being approached about school meal debt or submitting an application and filling it out correctly. On the administrative side, much easier to operate CEP. No longer have to collect and process applications, no longer have to meal count and claim for reimbursements. And it's much easier for kitchen staff as well. They can streamline service greatly. And then on the administrative side, they also don't have to perform that unfortunate task of sending notes home to families saying that they're in school meal debt. Now, like I mentioned before, the CEP was authorized by the Healthy Hunger-Free Kids Act of 2010, and it phased it in selective states before rolling it out nationwide. So from this, we've learned how an impactful and helpful CEP is for schools, for families, and students, and is something that should be expanded. Now, before I discuss the opportunities in this Child Nutrition Reauthorization, I wanted to give a nod to rural communities. At Save the Children, we do advocate for all children who are impacted by federal nutrition programs. However, we do have a unique lens on rural children as we work exclusively in rural communities on our programming. So as you'll see here, children in rural communities are especially vulnerable to food insecurity. Of the counties with the highest rates of child food insecurity, nearly 90% of them are rural. Food access and higher food prices in rural communities make it much more difficult to eat adequately and well. Distance to grocery stores, food pantries, and soup kitchens are often far, and transportation is limited, if present at all, in rural communities. So this is why it is so important that these federal nutrition programs in schools where kids are already going are so critical in helping families ensure children are being fed. Now, there are some best practices for schools in rural communities, and as a whole, it's about pooling and thinking creatively. Now, some of those things include creating a purchase cooperative. So some districts have created a purchase cooperative and partner with local businesses to drive procurement costs down and access additional foods. Implementing breakfast after the bell and grab and go is helpful. As you can imagine, if traveling far distances, often don't have the ability to get to school early. So these service models are very beneficial for them. And then some districts do backpack programming for the weekends and long holiday breaks. This is important as these rural communities and these schools understand the hardship and what communities face in terms of the lack of access to affordable, nutritious food, especially when children are out of school. Now for the opportunities in the CNR that relate to school meals are largely based around CEP, the Community Eligibility Provision. So what we'd like to do here is to lower that identified student percent threshold from 40% to 25%. This would allow a lot more schools to come onto the program as there's kind of a lower bar for them to reach in order to operate CEP. And like I mentioned earlier, as it stands now, it's not always financially viable. So we want to increase that multiplier factor from 1.6 to 2.5 so that schools can financially be okay running CEP. We've heard from a lot of schools, especially with lower ISPs, it can be tough to run CEP with the current framework and their budgets. And then statewide CEP. This is a key moment that would be really transformative to get even more schools on board and then greatly increase the access of nutritious school meals to children. And something I'd like to take a nod at, which I know Carolyn will discuss in a little bit more detail in the next section, is about guaranteeing flexibilities for school meals. In case another natural disaster strikes, we don't want to have to scramble. We want to have something that we can turn to and allow schools to still get reimbursed for the meals they serve if in a non-congregate setting. Right now, as legislation stands, students have to eat the meal all together in what is called a congregate setting in order for the meal to count as reimbursable to the school or institution. The pandemic shows that schools may close. We need flexibility for when something happens so that children can still eat the nutritious school meals, and on the other end, schools can still be reimbursed. And on that note, I will turn it over to Carolyn to discuss it a little bit more in the next session.
Yes, thank you, Cassidy. So I'm going to be discussing the out of school time program. So that includes the summer food service program, the seamless summer option, CACFP at-risk after school meals, and NSLP after school snacks. So what the Healthy Hunger Free Kids Act did for after school meals. It was a big CNR for after school meals because it created a permanent nationwide after school meals program. As a reminder, before 2010, there was really only an option for after school snacks, and that could be through either NSLP or CACFP. However, Congress had been authorizing pilots for meals through CACFP starting in 2000, but it wasn't until 2010 that the option for meals became available nationwide. So again, very exciting starting this new program. However, now that we are 12 years into this new nationwide program, we definitely have some lessons learned. First up, administration is challenging. And I say this with all the love in my heart as a former CACFP state agency staffer. It's hard. There's a lot of paperwork. And related to that, the differences between programs can be challenging to navigate. So a lot of the organizations that are serving after school meals, YMCAs, Boys and Girls Clubs, schools, they're already operating other child nutrition programs, but then they're having to learn the rules for a different program and figure those out to know, okay, the school bell rang at 3 p.m., different rules apply now. Okay, it's, after Labor Day, different rules apply than what we were following over the summer with the summer food service program. And so those can really trip a lot of people up, and it can really deter participation and expansion to new places. On the summer meals front, there are a lot of things listed here, but you'll see that they're kind of administrative. It wasn't really a big CNR for the summer programs. So just removing a cap on sites for private nonprofit sponsors, requiring permanent agreements instead of having to do annual agreements, directing USDA to establish disqualification requirements, similar to what you do have in CACFP for organizations that are in, can't come back into compliance, and a requirement for states and schools to notify family of summer site locations. So I can't say we really have a lot of lessons learned from the last CNR. The main thing is that all of the existing challenges with this program have remained because there wasn't a lot done to address them in the last CNR. So 6 out of 7 kids who may need summer meals pre-pandemic were missing out. The program was only reaching 1 out of 7 kids who was getting free and reduced price school meals. This program was doing a terrible job at what it was supposed to be doing. And that is because of a whole host of reasons listed here. Transportation, school buses don't run in the summer. So there isn't a guaranteed way for kids to get to congregate sites where meals are being passed out. Weather is a big one. A lot of summer meal sites are outdoors. So when it's scorching hot in Texas or Arizona or really anywhere, kids may not want to be outside. It may not be safe for them to be outside. Torrential rain, not to mention other more extreme weather, can all really affect participation and make it challenging for kids to get to a site and stay on site to eat. Safety concerns, again, if there's violence in communities or other public safety considerations, parents may not want their child going out alone while they're working to a site. It may not be safe for kids to stay outside and eat in that area. Limited summer programming is another barrier. Without a draw to a site, kids may not want to go. And we know that unfortunately there just isn't enough high quality summer programming for all the kids and families that may want it. And then limited area eligibility. So typically, in order to operate an open to all summer meal site, you have to be in an area where at least half of kids are eligible for free or reduced price school meals. So similar to what Jennifer alluded to on the childcare front, that can really cut off a lot of communities that may be just below that threshold. So there's still a lot of need. Maybe 49% of students eligible for free or reduced price school meals, but they're not able to operate that program, or at least not do it in that open to all fashion that can really reduce barriers and help get more kids to the site. Before I move on to opportunities and ways to address all of those challenges, I do want to note, though, that the Healthy Hunger Free Kids Act did authorize some pilots for alternative service models, and that included summer EBT and non-congregate summer meals. On the non-congregate side, I think it's fairly self-explanatory because we all went through the pandemic together and saw what non-congregate service really looked like. So USDA was piloting this model even before the pandemic, really took it nationwide. And we certainly learned a lot of lessons about what non-congregate could and should look like because of the pandemic. But I do want to say an extra note about summer EBT because you may be less familiar with this. It provides funds to purchase groceries during summer vacation, and those funds are provided on a debit-style EBT card, electronic benefit transfer card, similar to the way SNAP benefits are provided. And it's made available to families with students eligible for free or reduced price school meals. So this is similar to pandemic EBT, which you may be familiar with now because of the way those benefits were made available during COVID. However, in the summer EBT pilots, the benefit amounts were less. It was piloted at $30 or $60 per month per child, rather than fully replacing like the reimbursement rate for free school meals. And in the pilot states, it was offered on a more limited basis than, all free and reduced price eligible kids in a state. But again, I think pandemic EBT has shown us a lot of lessons about how summer EBT can work and about how the administration can work to be more smooth. So with that, what are our opportunities in a next CNR and what we would be looking for? One, streamlining after school and summer meals. Again, a lot of organizations are operating both programs, and yet they're being required to apply for them separately, work potentially with separate agencies, even because CCFP and SFSP may be in separate agencies. They're following different meal patterns. They're doing different paperwork. So we need a streamlined program the same year round so that people aren't being tripped up on these different requirements and can really just focus on serving kids healthy meals year round at their program sites. Next is a permanent nationwide summer EBT program. We know this is so effective at reaching kids because, again, of all of those challenges with traditional congregate summer meal sites. It gives families the flexibility to buy the food that works for them. It was proven in the pilots to reduce very low food insecurity and to improve kids' diets. They were purchasing healthy foods with those summer EBT benefits. So we really want to see this rolled out nationwide. In addition to that, we also want to see a permanent non-congregate summer meals option. We really think, given how dire summer hunger is, that there needs to be a both and approach. to meet families with where they are, and provide them with the support that they need in the way that works for them. We know definitely through pandemic EBT, with just the administration of getting that EBT card to families and kids having to be eligible for free or reduced price meals, it's not necessarily going to reach everyone who needs it. And so those open to all sites where kids can come and get meals is always going to be necessary for some families. And again, it may just work better for some families who have transportation barriers getting to a grocery store, have other barriers to cooking and prepping meals. So those non-congregate summer meals can be so helpful in areas where there aren't summer programs, where there's transportation challenges, where there are weather challenges, that kids can get a meal and take it home and eat it there. Or even better, as we saw through the pandemic, that organizations can serve multiple meals at one time, that they can do like a weekly meal pack. They can even home deliver those meals, so that especially for those kids and families with the most barriers to getting to sites, that they are really able to get the support that they need in a way that works for them without having to physically go to a site for every single meal or every single day. And then another priority is lowering that area eligibility threshold from 50% to 40%. That would open up to a lot more communities, especially rural communities that may have big school district areas where that number doesn't fully reflect the need. It would also better align with funding structures for summer and after school programming. The federal threshold for that funding is 40% as well. So it would help to open up the programs to more kids. Of course, we'd also love to see an additional meal option over the summer. Currently, it's limited to just breakfast and lunch, or a meal and a snack, as well as Cassidy alluded to, more flexibility for future disasters and emergencies, knowing that USDA should have this waiver authority whenever they need it, not just when it's specially authorized by Congress. And then additional transportation funding and other things like that to support where there are congregate sites that are working for families, and kids just need help getting there. So I'm sure all of us could talk all day long about what we would love to see in CNR, but we would love to hear more from you now. If you have any questions, please drop them in the Q&A, whether about the process, about any of the priorities that we mentioned, or just generally about any of these programs.
So I don't see any questions in the Q&A quite yet, but as you all were talking, did anything else come up for you all that you wanted to share as folks are pondering their questions?
Well, one thing that I'll share is actually while we were on this webinar, USDA did announce the proposed WIC food package revisions. So a good example of, right, things are really happening right now around child nutrition reauthorization. So be published tomorrow in the Federal Register, but we have updates to the WIC food package that were just announced today. And again, this is, part of the rulemaking process, not child nutrition reauthorization, although the Healthy Hunger Free Kids Act required them to look at the WIC food package at least every 10 years. And this will be, USDA Food Nutrition Service is publishing their proposed updates, which do include increasing the fruit and vegetable benefit. And this will be an open comment time for individuals and organizations to put in their feedback on the proposal, and then it will be finalized after that. So that was happening while we were talking.
Always exciting to see federal policy in action.
Yeah, and I see, Christine, thanks for the question about making it easier for CACFP to purchase local produce. I mean, yes, I think that would be really helpful. I will say that in my years of working with CACFP and working in community food projects, it is harder to work with childcare centers. I mean, it's, I mean, schools can be challenging too, but at least there's a central part, central person at least to try to go to in the public school systems. And childcare centers are, right, so much more fragmented. And so where we have found challenges is working with, the local producers and then, the CACFP providers to try and set up, purchasing methods and procurement and all that. But there's been some good studies around, supporting, cooperatives to do that. Some of it, I think, is just pure helping network and educate on both sides, for local, farmers and growers to understand how the child care system works and where they're purchasing their foods. And, there's a really good ECE, farm to ECE, group and movement going. So I think that those are all good resources. But I think it's, we've just found it is really, it's tricky with the, childcare providers and the very diffuse way that they're set up. But I think there's tremendous opportunity there. And we know for sure, right, exposing kids at those young ages to local produce and local foods more broadly gives them, the exposure to that really does expand their taste horizons and set their palates going forward. So it's really worth the effort.
Carolyn, Cassidy, do you all have a final word you want to share?
Well, I'll just say one thing that I did not know when I was giving my overview of the process is how to actually get involved with all of this, which I think is important to cover. I don't really know what sector all of you attending today represent, but assuming some of you are either child nutrition program operators or work closely with them, I think reaching out to your representative or your senator and inviting them to see what your program looks like in action can always be great, or just calling them and letting them know, what you're doing and what is working and what could be better is always helpful kind of in that long-term relationship building. Just knowing that, again, we're in a tricky place with CNR where maybe it'll happen, maybe it won't, not really sure what it'll look like. So just again, that plug for that long-term relationship building so that your member of Congress knows what could be improved whenever there is an opportunity can be important. And then I guess staying tuned for action alerts. So a plug to kind of get involved, whether through Save the Children or Share a Strength No Kid Hungry campaign, School Nutrition Association, so many others sending out action alerts when there are kind of tangible actions to be taken at a critical moment to make sure that you're making your voice heard and getting these critical changes over the finish line.
Yeah, and I'll just add, I think this is a really exciting time for the child nutrition portfolio as a whole. The pandemic was absolutely horrible, and frankly, we're still working through it, but I think we have so many lessons that we have learned from it, particularly with child nutrition programs, that now is the time to capitalize on them. And so do get involved, do make your voice heard. Things are moving and shaking as we speak, apparently, hopefully, with the Child Nutrition Reauthorization. And so we hope to see something rise to the surface soon. So definitely stay tuned.
Folks, we just had a question come in. Would you all be willing to reiterate why CEP isn't always financially reasonable? I just want to make sure I remember that fact. Thank you.
Yeah, sure. And Carolyn, you jump in as well. It's not so straightforward, but basically in order for schools to get reimbursed, there's the identified student percentage, which that encompasses those who are categorically eligible. So the students who are categorically eligible. So if they're on SNAP, TANF, DIPPR, a migrant in foster care, the list goes on. And then the ISP is then multiplied by the multiplier factor, which right now is at 1.6. in order to come up with how many of their meals are going to be reimbursed. So right now, the threshold for that ISP is 40%. And as legislation stands, the multiplier is at 1.6. So if we do the math for that, that's only 60% of the meals covered. So this is why it's not always financially viable, because schools typically have to find other sources of funding to cover the rest of the meals, which they absolutely can. And there are multiple ways that they can, but those federal dollars for schools are so important for them to get reimbursed for the full amount. And Carolyn, please hop in as well.
Yeah, I know. In some respects, I feel like you need to have like the math equation written out. At least that's how I learn. So I will say I have our contact information here if you want to get in touch with us, and we can walk through some of those financial examples in more detail. But I see the follow-up question in the chat: is CEP reimbursed at the same rate as NSLP free meals? And so to what Cassie was talking about with that formula, it's yes and no. It's like it's saying what percentage of your meals are you going to have reimbursed at the free rate, and then what percentage are you going to have reimbursed at the paid rate? And the paid rate is like a really teeny tiny little subsidy. So if you're only getting 60% of your meals reimbursed at the free rate and the other 40% at that teeny tiny paid rate, it's, you know, those are the NSLP reimbursement rates, but you're not really getting the full amount of money for all of those meals, and no students are paying in extra money to kind of help make up the difference for those meals that you're getting the paid rate for, in the same way that traditional counting and claiming school paid students are typically paying some money that helps make up some of that difference. So I hope that helps to clarify, but again, it's complicated, there's math. We're happy to walk you through it if you do want more details on exactly how that works. And why it can be so challenging for so many schools that are at those lower eligibility thresholds.
Well, it looks like we're at time, so I want to first say some appreciation to Cassidy, Carolyn, and Jennifer. Thanks for sharing your expertise and experience with us today. Up next is our closing session, where we will announce our first ever HFC honoree and hear from keynote speaker Barbie Izquierdo. To join this session, please click the main stage sessions in your navigation bar to the left of your screen just before they begin. That concludes our workshop. To exit the session, please click on the red phone icon at the bottom of your screen and then click leave. Have a great rest of your day. Thanks all.
All right, I think I'm gonna hop off. Thank you both.
Thank you, Carolyn. Thank you, Jennifer, for helping put it together and pulling it together. Have a good Thanksgiving.
You too. All right, bye.
Yeah, you too. Bye, thanks.